Hi guys, good evening from wherever part of the world you're watching me from. My name is Carlo Awesome. I'm a 50 medical student in a Nigerian university and I make educational videos. I make medical school content. In case you're stumbling on my channel for the first time, kindly subscribe, turn on your notification bell so that you'll be notified of subsequent videos I'm going to be dropping. This particular video is a banger. When I mean a banger, is a highly requested video. A lot of person have been asking me, oh, how were you able to, get distinctions doing your third MBBS and stuff like that, knowing fully well that third MBBS exam is a dreaded class in medical school because of the workload. Apparently, because of the workload, the third MBBS program comprises of your pathology and your pharmacology. Of course, the pathology comprises of the hematology, the medical microbiology, your histopath or your morbid anatomy, and of course your clinical chemical pathology or clinical biochemistry, anyone. So this class has a whole lot of work to be done, but then I'm going to tell you guys that it is one of the simplest classes you can actually encounter in medical school. That is only if you do the right thing. So I have my laptop here and I'm going to be sharing some few points so that I won't miss out on anything. So guys, I'm so excited to share this video with you. So let's go straight into this video. In this section, I'm going to be talking about pharmacology, and I'm going to be talking about pharmacology based on the materials to use, and then I'm going to give some study tips on how to retain pharmacology more and do well in the exams. Principally, I understand the fact that pharmacology is very volatile. Yes, it was volatile for me, but still yet, it was my favorite course. But I found pharmacology very easy. But I'm not arguing the fact that pharmacology is very volatile. But understanding the volatility of pharmacology will make you to devise a means to make it to stick. And I'm going to share it in this video. So I'm going to be starting with the materials. Which material am I going to use? Which material am I supposed to read? Now this question comes up in the minds of essentially people that just are starting part and farm clerks. Most of them are excited to learn drugs, most of them are excited to, be in clinical school and stuff like that. So they actually want the best for themselves, and then they are out there looking for the best materials for themselves. There are a myriad of materials out there for pharmacology. We have good textbooks, we have very standard textbooks, we have the KD Triparty Essentials of Pharmacology, we have Gilman and Goodman, we have Ragandell, we have Carlzong, we have Lippincott, we have Shambang, we have Shama, we have a whole lot of textbooks. But are all these textbooks necessary for you to learn pharmacology? Don't worry, I'm going to answer it in this video. First and foremost, I want you to prioritize your lecture notes, your lecturer's materials. That should be your basic. You should not, I'm not saying that you should not learn outside your lecturer's materials. No. But your lecturer material is supposed to be basic. It's I don't really know. It is, to me personally, it is more than sufficient for you to pass pharmacology. We have lecturers. In fact, in medical school, every lecturer is like after delivering their lectures, we release materials. It could be in the form of slides, it could be in the form of handouts, it could be in the form of notes. So whatever materials your lecturers release for you, please, that should form your foundation. Any other thing you are adding should be building on it. Please don't neglect. Having said your lecture materials is your number one priorities, I can now start adding any other point I want to add. Second is videos. I'm a video person, and I can tell you guys that videos helped me a lot. Now, there are a lot of videos out there on the internet. We have Kaplan videos, we have Ninja Nerd. There are a lot of them. It's all about the one you flow with. Do you understand? It's all about the one you flow with. I can watch more than one video, okay, just for me to understand something. I remember, when I was learning antiviral drugs, for instance, it was very difficult for me knowing their mechanisms of action, even after listening to a whole lot of videos. What did I now do? I now said, okay, I modified my search. And I said, antiviral drugs animated, something like that. I needed an animation on how these drugs were actually working. And I saw some videos where they animated how these drugs actually work, how they play. Do you understand? It now makes sense. What was in the slide, what was in the handout now makes sense, because I was able to correlate it with what I saw in the animation videos. So you might not just stick with one video, just check out a few more videos that led you to understand that. Most times, whenever I used to tell persons, if I'm searching videos, I will say for dummies. For dummies. Okay, let me just say, explain the mechanism of action of this drug for dummies. I'll add them dummies just to modify the search so that it will actually narrow the search down to maybe, if you understand what I'm trying to say, the person that is trying to learn this doesn't even have the slightest idea on what he's trying to search on, and so the search will be modified to suit what I actually want before I can now start building it up and stuff like that. There are good YouTube videos online. I mean, there are a lot of them, but I cannot really recommend anyone at the moment. I can only recommend for pathology, which I'm going to talk about, histopathology specifically. I mean, that video saved my ass in histopathology. Okay, so I'm going to share that particular video. Did I open textbooks? Yes, I actually did open textbooks, actually. But most of the textbooks I actually opened were for reference. Do you understand? What I'll do is that I'll first and foremost watch a YouTube video on the topic. Let's say I want to read something like anti-seizure drugs. I'll first of all watch videos, couple of videos on anti-seizure drugs. That's the first thing I'm going to do. After it, I'm not going to jot anything down. I'll just be watching the videos. What am I doing? I'm just trying to, understand the concept, like trying to get an idea on what these people. Of course, I was in class. I listened to my lecturer explain it, but then I have to build on those concepts by going back to see a video. After seeing the video, I will now go back to my lecture materials and maybe open textbooks and make my notes. So while making my notes, I try to make my notes from my lecture materials and from the videos I watched and the textbooks. Okay, that is how I did it. So I used textbooks actually. One of my to-go textbook was Goodman. Goodman is the Bible of pharmacology. Goodman is so big. Students use Goodman, postgraduate students use Goodman. But one thing I like about Goodman is that the English is very simplified, except the molecular aspect. It can go molecular, but then those molecular things might not be actually what you might need as an MBBS student. Except maybe you want to further more studies in pharmacology, then you can go for those ones. But it might be essential to understand the molecular aspect. But I feel like the molecular aspects were highfalutin, so I didn't need them. I just went to mechanisms of actions, adverse effects, clinical uses, and important drug-drug interactions. These were the things I was looking out for in Goodman. Now, Goodman, like I told us, is the Bible of pharmacology. Anything Goodman says is standard. Kazong is also good, but I actually found Kazong very difficult to comprehend. I comprehended Goodman easily than Kazong. And Kazong is so scattered. Do you understand? So most of the informations we are not actually well outlined. So I actually prefer to use Goodman. So Goodman is one important reference textbook I'm going to recommend you guys to use. Goodman explains mechanisms of actions very detailed. It explains important side effects, clinical uses of drugs, and some other things as well. Now there is this very book. It was my holy grail in pharmacology. It's not a conventional book actually, and a lot of persons don't even know about the book. Funny enough, I was actually the only person that used this book in my class, and that book is called Sharma Principles of Pharmacology. I'm going to upload the picture here so you guys can check it out. One thing I like about this book is that it actually pulled a lot of information from standard textbooks like the same Goodman, because I saw some information from Goodman, from Kazong, from KD Tripathi, and merged them into a very beautiful, easy to read textbook. I've actually not seen the hard copy, but I use more of the soft copy. One thing I like about the book is that it explains the physiology of the thing you want to study before going into the pharmacology. In my previous video I made some time ago, I told us that for you to understand pharmacology, you must understand the physiology of what you want to do. For instance, you want to understand antiepileptic drugs. You must first and foremost understand the physiology, what's actually happening in the body. Okay, because you are trying to use the drug to, address a dysfunction in the normal physiology. You want to use the drug to alter something in the body. You must first of all understand what is actually going wrong by understanding what is happening, what are the neurotransmitters involved, what are the functions of these neurotransmitters, how do these neurotransmitters work, and stuff like that, before you will be able to. So I love Shama because Shama will actually take me through the physiology before going to the pharmacology. Like you want to study about peptic ulcer disease, drugs for peptic ulcer disease. It will take you through what's actually happening in peptic ulcer. Okay, there's increased acid secretion. Okay, there's presence of H. pylori. Okay, there is this. Okay, there is that. And so we need drugs that will target this place, that will target. It makes you to be very, very systematic in your approach. And pharmacology is very systematic. Pharmacology is not haphazard. Okay, and these are things that will actually help you. Okay, so I will actually recommend Shama anytime, any day. I never opened after the first time I tried reading Kazong, and then it was not flowing. I dropped Kazong. Everybody was talking about essential tripartite. Yeah, tripartite is very good. I like the fact that tripartite is actually organizing points. Okay, so it will be easier to read. But then I barely used tripartite, so I don't really know. I don't have much to say about tripartite. But Shama is also organized into what? points, like, it's well outlined, and that makes it very easy to read. Okay, so but the best thing is stick to any textbook that works for you. So the textbook that actually worked for me were Goodman and Sharma. So I stick to them throughout my stay in pharmacology classes. So that's all about it. The next thing I'm going to talk about is have a drug book. Have a drug book. Well, my drug book was actually my notes. When I mean a drug book has to do with a book where you have classifications of drugs. Now, the bulkiest thing you have to do in pharmacology, or like the major thing you have to do in pharmacology, is knowing the classes of drugs. There are a lot of drugs, a whole lot of drugs. Now, it's not left for you to organize these drugs into their families, know where each of them belongs to. There are different drug books actually. We have drug tales from CMDA, those ones are nice. But I personally made my own drug book myself that would suit me. Before I write any exam, that has to do with classification. In fact, any of my lecturers that is going to watch this video will be able to witness that that's my pattern of answering questions on classification. Because you cannot run away from any question that has to do with classify drugs. You must always meet classify. They can either ask you to classify NSAID, ask you to classify anti-arrhythmic drugs, ask you to classify antihypertensive. You must know drug classification. That is the bulkiest work you have to do in pharmacology. Now, having known that, or having borne that in mind, I had to make my own drug book. So I classified the drugs myself. Now, because I know that they'll ask me to classify the drug, I personally did it myself. Now, when you classify that drug by yourself, it is easier for you to retain it and reproduce it in the exam, because you are the one that classified it, and you classify those drugs based on flow charts. See, I cannot overemphasize this. Each time they ask me to classify, okay, one of my lecturers called me one certain time and told me, when he was marking my script, he saw how I classified my drugs, and he was impressed that I had to give me the full mark there. Because I made sure that when you ask me to classify a drug, I'll present, or in fact, if you ask me to talk about any drug family, you just say, discuss antidepressants. I'll first of all classify the drugs for you. Or you say, discuss antihypertensive. I'll first of all classify, because that's the major thing they want to see before you start talking about any other thing. But then, I'm strictly talking about when they ask you to classify drugs. So when they ask you to classify drugs, try and present it in a flow chart. You put a flow chart, put the arrows, and then put your drugs there. Some persons will just be writing it as if they are writing essay. It is wrong. Anyway, I'm not yet in the study teams, but I'm trying to tell you that one of the materials you actually need to do well in your pharmacology is your drug class or your drug book. Like I told you earlier, my drug book was in my notes. I was trying to separate it at some point, and I found out that it is actually a whole lot of work to do. So what I did was, inside my notes, I will classify the drugs there. So my notes comprise of both my drug book and my notes and any other information. Okay, so you have to have a drug book. Be very intentional about it. So before my exam, I could easily classify a lot of drugs because I have done it over and over again, and I did it myself. So in exam, so in this section B now, which I'm going to be talking about, the study tips. Yes, I understand the fact that pharmacology is very volatile. So how can we study pharmacology in order to maintain it? In no particular order, mnemonics. I use ChatGPT a lot to generate mnemonics. Please, generate mnemonics that are very, very easy to remember. I had a lot of mnemonics. And one thing is that when you are the one generating that mnemonics for yourself, it will be easier for you to remember if you generated the mnemonics by yourself. Of course, you can actually go online and search a lot of mnemonics. A lot of persons have actually made very simple mnemonics. I can remember one of my exams was to talk about adverse effect of phenytoin. I remember that I looked for mnemonics on that. In fact, you need mnemonics for most adverse effects, especially adverse effects, mnemonics for adverse effects. So I looked for that. The same mnemonics is this phenytoin. P450 induction, hirsutism, osteomalacia, nystagmus, okay, gingival hyperplasia, all those things was outlined there. So it was easier for me to, reproduce it. So mnemonics, you cannot do without mnemonics in pharmacology. Pharmacology is one course that you actually need mnemonics. And when I mean mnemonics, I mean workable mnemonics. Form your mnemonics, make fun of it. I remember one of the mnemonics I had for my what's it called? drugs for dyslipidemia was Pons. So I know I coded with it with Pons beat ezetimibe frequently. The P for PSSK9 whatever inhibitor, okay. O for omega-3 fatty acid, N for niacin, S for the statins, statins and the rest of them. Okay, BEAT stands for bile acid sequestrant, okay. Ezetimibe is a class on its own, the cholesterol absorption inhibitor. Then frequently it stands for the fibrates. Then you know the classes of drugs on that. I had a whole lot of mnemonics. This one was the one I actually made by myself. You know, there are lots and lots of mnemonics. You can generate mnemonics for yourself. You can ask AI to generate mnemonics for you. You can go on Google to search for mnemonics for you. But please use mnemonics to study pharmacology. Of course, the next tip I'm going to share with you guys is past questions. See, you guys cannot do without past questions in medical school. In as much as I'm not this kind of person that studies past questions with the idea that, oh, they're going to repeat it. No. I study past questions to actually know the pattern questions can be asked. And I study past question per topic I read. You know, there's something I discovered a lot of my classmates were doing. They only bring past questions towards exams when they're about writing exams. Probably they have finished reading a lot of things, then they will start going through past questions and stuff like that. It might work for them, but someone like me, you won't see me going through past questions during the exam. I must have gone through them while I was prepared, like while I was reading before the exam. So what I'll do is that each topic I've read, for instance, let me use anti-Parkinson's drug for instance. Okay, let me just say I read anti-Parkinson's drugs today. I'm going to bring a lot of past questions. We see though, first in course, you know these things you guys are doing, you're preparing for first in course, you only use first in course past question. It is entirely wrong. Because for me, for instance, they might have taught anti-Parkinson's drug in first in course, but for another state, they taught it in second in course. You see? So what I did was I'll get first in course, I'll get second in course, I'll get mock, I'll get name, I'll get receipts. So I'm just trying to get a wide perception on ways these questions can, be twisted or can be, coined. Do you understand? And truly, I actually found out that there are different ways. Apart from you, as I'm talking about classify anti-Parkinson's drugs, there are other things that I've seen they can ask in that same anti-Parkinson's drugs. One of them, when I was reading, was I came across where they discuss the on and off phenomenon associated with the use of levodopa. Yes, it is one of the side effects, but I didn't even expect that it could be a question. When I saw the question, what I did was I was not like, I have to make notes on this. It was in part of my side effect on levodopa. But for the fact that I've seen it as a question, I carried my kazon because I saw that question there. And I said, okay, if this question comes, how am I going to answer it? I should have an outline. Introduction. What is on and off phenomenon, like the mechanism of on and off phenomenon, talk about it. Even I have to even add the management of on and off phenomenon, characteristics of on and off phenomenon. Some ideas are just coming into my head so that I can make an outline that can follow when I will be asked that question. Apart from on and off phenomenon, they've asked different questions that is still surrounding those anti-Parkinson's drugs. So it's not only classifying anti-Parkinson's drugs, there are other ways, and it is when you're a regular visitor of past question that your eyes can be opened. So before any exam, I already have some working questions in my head. Oh, this is something that can come out. This is something that can come out. That's why some of my friends will be like, awesome, what kind of question can come from here? What kind of question can come from here? Because they know that I'm a regular visitor of past questions. But mind you, don't solve past question because you're expecting it to be repeated. No. You are solving past question with the idea that, okay, you want to know the pattern of questions. And of course, solving past question will give you high yield facts. Now, there are some topics that are high yield. There are some questions that they cannot do without. Year in, year out, they must always ask it. That is what past questions can actually help you divulge, can actually help you to, grasp. Now, the next tip I'm going to talk about that will help you to retain pharmacology is to discuss pharmacology with your friends. When you teach other persons, you tend to retain more. That is why it is very difficult for me to turn down any request from people, no matter who they are, my friends, whether you're my friend or not. As long as you meet me and ask me, okay, awesome, can you help me with this? And I know it, I'll be willing to teach you because I know that when I teach you, I'll be able to retain more. So you'll be able to retain more when you teach other persons. Okay, I know all of us might not be gifted to be teachers, but then we know people that we are comfortable with, even people that we are not afraid to make mistakes in their presence. You can call them, please. It can be your discussion group members. You can discuss what you've learned. You can discuss what you've learned with a friend. If you have a junior colleague, you can discuss with a person. You can discuss with, you understand? So the main thing is just for you to say it. Do you understand? And of course, whenever you are going to discuss something with somebody, you have to read that thing, right? So that you have to make your revisions, you have to read it, you have to, when you are preparing, I learned this a very long time ago. So if you are preparing to teach somebody, you are going to read that thing over and over again. Do you understand? And even practice it before you actually finally meet the person. So teaching will help you to retain pharmacology the more. Please, is very. I think the next point I'm going to talk about is answer your pharmacology in bullet points. Stop writing essay, long essay. In fact, if you have a flow chart to explain mechanisms of action, please do so. Once they look at it, everything is just, they will just mark you. Than reading all through the sentences, long sentences, just to get no. I'm just trying to tell you strategies that I feel like I used that actually gave me an edge. So the mechanism of action, I'll put it in a flow chart. This will happen. Once this happens, I'll draw an arrow. Look at the next step that will happen. This one will activate the second messenger. The second messenger, I will just beautifully illustrate it. It's a strategy. Devise your own. Like, there's one thing my lecturer will always tell us. Devise your own concepts. Like I told you, pharmacology is universal. As long as you're writing something that is correct, it is correct. Take it anywhere. It is absolutely correct. Take it anywhere. No matter how you're writing it, as long as it is the correct thing. Do you understand? So I'm only trying to tell you to distinguish yourself from other persons. Stop writing in long sentences. Write in bullet points, if possible. Write in flow charts. If you are talking about mechanisms of action, write in flow charts. And of course, you should know when you're writing side effects, there are major side effects that should come before. Some persons will just be writing nausea, vomiting, nausea, vomiting. Please, there are specific side effects that are very. So, there are specific side effects that these people want you to mention first before talking all those gibberish. It's just like when you want to talk about alpha 2 agonists like your alpha methyldopa, your clonidine, and the rest of them. They are looking for rebound hypertension. Like, that's very important. Rebound hypertension. It's very unique with them. It's not like they are the only drug. The other drugs that can cause rebound hypertension, but these drugs are notorious for rebound hypertension. Just like alpha 1 blockers. Your praise was seeing them and the rest of them are notorious for what? Orthostatic hypertension. Orthostatic hypotension. Like, these are the very important thing they want to see. Mention them first. You want to talk about ACE inhibitors. You are not mentioning dry cough. You haven't written anything. That they are the most important things. So learn the art of writing pharmacology exams. Okay, another tip I'm going to give you guys in pharmacology is the method of answering pharmacology question. Now, I don't know, for my school, one of the way except there are some lecturers, you should study your lecturers very well. And one of the ways in studying your lecturers is being in their class. Because when you're in their class, they tell you their mind. They tell you what they expect from you in exams. Like, I have a lecturer that doesn't like you to write introduction. Please just go straight to the point. If you write introduction, there's no mark. I have lecturers that you must write summary. Like, for them to give you your full mark, they must see summary. And these are things they'll tell you when you come to class. So that being said, I want to make this point. Now, in my school, there is a pattern they normally use in asking some pharmacology questions. They will say discuss something like this with emphasis on mechanism of action, side effect, clinical uses, blah, 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 blah. That emphasis on means you're not supposed to be limiting yourself to that. If you have any other thing you want to write, you can write it. But make sure you emphasize on those points they outline for you. Because that's the major thing, or that is what carries the bulk of the mark. But if you write any other thing, that is one strategy to get a distinction in pharmacology. One of my questions was to write on classify antihypertensive drugs. Classify antihypertensive drugs, talk about the clinical uses, talk about the mechanism of action, that kind of question. And the fact that I knew the lecturer that taught it was actually Professor Gassi. Most of us will know Professor Gassi. I knew, yes, Professor Gassi, you don't need to limit. Write anything you know about that thing. And now calm down. I first classify the drugs. Like I told you, each time they ask me anything about drug classification, I will first classify it in a flow chart. So the whole classes of antihypertensive was all in one flow chart. I think I had about 9 or 10 classes. I brought them out and I gave drugs. I wasn't limiting myself because he didn't tell us any number of drugs to write on. I just was writing as much as I could remember. That being said, I started by defining what hypertension is. So now I'm stressing on this part because I know the lecturer. The lecturer is not going to get pissed off because I'm writing all these things. I'm trying to gather more mark because I know he's somebody that can give you 20 over 20. And for you to get that 20 over 20, you must, exhaust your knowledge, everything you know about that. I talked about grades of hypertension though. I talk about the, what's it called, pathophysiology of hypertension. Because when he was giving us the notes, Professor Gassi is someone that will talk about these things. We tell you what we are trying to treat. If it's angina, if it is, all of us that know him knows that's his way. If it's angina, if it is arrhythmia, he will tell you what arrhythmia is, what causes arrhythmia before going to the drugs. And it is not wrong if you write the same if you have the time. But if you don't have the time, please go straight to the point, especially if you're a slow writer. For someone like me, I wrote grades of hypertension, mild, severe, and the other one. I wrote about the normal regulatory mechanisms. I wrote all those things. I wrote about what's it called? Like, I was just giving very, very short notes on those things, but I was capturing those points before I now went to the drugs, their mechanism of action and side effect. The other question they asked me, they didn't even ask me about drug interaction. Some of them didn't even ask about pharmacokinetics, but I'll make sure that those main points they asked me to emphasize on, I'll emphasize it. Then I'll now start adding extra information. I'll add drug interactions. I'll add pharmacokinetics, even when you didn't ask me about pharmacokinetics, so I'll add it. I'll add pharmacological action, even when the question did not read pharmacological action, but the question says with emphasis on. Now, the lecturer will even give me mark. That is why someone, Mr. A, will have 50, and someone else will be scoring 80 something. Yes, it's common sense. Apart from MCQs, I'm talking about AC. MCQs is another, you understand. For you to be good in MCQ, you have to read. And you don't have to just read your material, you have to read in depthly, even with textbook, for you to be good in your pharmacology. But I'm going to talk about that later on. But I'm only telling you guys how you can answer to get more mark in your pharmacology exam. But if there are lecturers that are very strict, like my head Jody, if my head Jody just say, please classify with one drug example, I'm not going to do too much. I'll give one drug example because he is someone that wants you to go straight to the point. And what he tells you, please do it for him. Okay, so learn how your lecturer wants his questions to be answered. Do you understand? So guys, this we are the very few things I needed to talk to you guys about. I know it's not going to be very easy, but then trust me. Commitment, focus, hard work, consistency will actually help you to achieve those things. If you actually learn a lot and you have any other question you need to ask me, you can. For those of you that have my WhatsApp line, you can always send me a message on WhatsApp. For some of you that have me on Facebook, you can always send me a message on Facebook. For those of you that don't, you can actually send me a message under this video. I'm going to reply you guys. If you have any other personal question or any other comment, any other review or anything you want me to elaborate further on, you can always drop it under this comment. I'm going to see it and I'm going to address it. Please don't forget to like this video. Don't forget to subscribe. Don't forget to share this video to your friends. I will see you guys. I wish to see you guys